things are dynamic and you can't stop. The work never stops. And because there's always going to be inflow and there's always going to be challenges. And as long as you plan for that and you adjust, you have to adjust. You're going to have some failures. You're going to have some ups and downs. And one of our city leaders uses a wonderful term that I think she coined, relentless incrementalism. And it's that you can make a difference, but you have to accept that you're going to have these bumps along the way, and you have to adjust to those changes and tweak it, learn from your failures, double down on your successes, and and really monitor the outcomes and be very frank and accountable in public.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
In the previous episode, Gordon and LaShawn spoke with two changemakers from Bloomberg Associates about homelessness as a public health issue and why homelessness as an issue in itself is homeless. In the final part of the discussion, Linda and Tamiru remain to discuss challenges and opportunities that emerged from the pandemic and highlight some unique solutions to homelessness from their book, How 10 Global Cities Take on Homelessness, Innovations That Work. This is where they left off.
The global community has been dealing with an unprecedented pandemic for the past 17 to 18 months, and this may have brought on some challenges, and to my surprise, some positives have come out to this in regards to homelessness. Can you talk about some of these positive impacts of COVID-19, if I were to phrase it like that, and also any challenges that have kind of resulted from COVID-19?
Well, let me start with some of the surprises that happened, and then Tamiru, maybe you can take up the challenges. What's really interesting in emergencies is that it just makes people behave differently. Like suddenly something that felt impossible yesterday, you're doing it today. The urgency of the matter just causes people to step outside of their silos, to be willing to break rules. It's an emergency is a time of asking forgiveness, not permission, if there ever is one, and you just go and you do it. So like a great example is in New York City, they closed down the subway. And so in the middle of the night, where, my daughter went to college in Boston, and she called up and she's like, "This is outrageous. The subways close at 1 o'clock. Except in New York City, she just grew up there and she's used to 24/7. The subways never close down. So during COVID, they actually shut the subways down, and the subways are a place, and we know we've been working on it for years and years and years. There's, from anywhere from 1,000 to 2,000 people that are sleeping in the subways every night. We know the patterns. They know the longest end to end line, and they will sort of bed down, and they know they're not going to get disturbed until they get to the other end. And so by closing down the subways, we knew that it was going to push a large number of people who were otherwise taking shelter there. And so it was really used as an opportunity, quite frankly, so the street outreach folks worked intensively. They were all ready to, they had buses at the terminal stations, people coming off the subways. They were ready to bring them right to shelter intake and move them into a shelter bed. People didn't want to get on the buses. They're like, I don't want to go schlep all the way down to 30th Street in central Manhattan in order to then be shuttled somewhere else for a shelter bed. And so what they did at, in 2 o'clock in the morning, they sat there and they actually reworked the shelter intake system and allowed for virtual placement of individuals straight to a shelter bed. And they got 800 people to take a shelter bed. And so that innovation of dropping the barrier to the entrance for services so that people were more likely to accept shelter was a huge improvement. All of those people that were choosing to just sleep on the subway night after night after night are now suddenly taking that first step toward normality, services, support, And then moving on, that's the pathway that's going to get them toward permanent housing and out of homelessness. And so now, as you know, I wish I could say COVID is over. We know it's not. But as the subways are reopening 24/7, the question is, okay, what do? Do we go back to how it used to be? No. We keep that innovation. We learn from that, the great lessons that come out of innovation. In Houston, it was a time that they were actually able to bring many providers together who hadn't been working together collaboratively, as we were talking about earlier. During COVID, it was like just, roll up your sleeves. We got to make this happen. We're going to do what it takes to address these needs. Everybody, bring all your toys to the table and everything that you have, every resource. We're going to put it all in a central pool, and we're going to go through all these individuals, and we're going to figure out how to make the best match. And so instead of everybody sort of keeping their own resources to themselves and accepting or rejecting people based on whether they believe they fit into their services, they pooled the resources and allowed the most efficient match across services. They're going to keep that system there in Houston now as we move into a new, stage of life. So these lessons can change behaviors in a way that people find great benefit out of it.
And one of the concerns is that that COVID is likely here to stay, and everyone may not agree with that, but I think it's becoming more and more apparent that it may become a disease that is similar to something like the flu, where we know that in the United States we're going to start recommending boosters, or we have recommended boosters for people starting very soon. And even back in May of 2020, you had a senior official in the World Health Organization, Dr. Michael Ryan, saying COVID is here to stay. You had the former U.S. Centers for Disease Control and Prevention Director Tom Frieden, who said COVID is here to stay. And so it's something that we have to adapt to. And that doesn't mean it's going to be like it is now. We'll have hopefully around the globe improved vaccinations among all populations, so we have a baseline, and then you have the kind of petri dish of ongoing variants, and then as well you'll have more effective treatments. But the issue is, you're going to have to deal with this challenge, and then you have economies that have been battered. So you have people that could potentially lose their jobs. Still, you have precarious government budgets. So the money that Linda mentioned that was poured into these initiatives, will those resources be sustained? And that's a big question too, because now so many cities, and I'll talk about the cities since it's a topic of this book, made progress in bringing people off the streets. Are the governments going to keep the resources going and it's a long-term resource that's needed to build housing. It takes several years. So that's one of the concerns, is now what happens, and it's tough to say. And then so one more thing is we still have ongoing challenges. We mentioned and Linda writes about this in the emergencies and disasters chapter. We have ongoing humanitarian crises, and look at Afghanistan, and we've seen so many migrants pour into Paris and Athens from Afghanistan and Iraq and Syria in the past, and Venezuelan migrants pour into Bogota and or Lima, Peru, and so you see these other crises are ongoing, and then you add to that climate crises like the Houston experience back in 2017. I mean, Nashville had a huge tornado that occurred as well recently. So you have all these ongoing crises that are not going to stop, and that adds to the to the already heavy burden of dealing with this this challenge during a pandemic.
You're making me remember, Tamiru, when we were working in Bogota. They were negotiating the peace agreement with the FARC, which was the entity they had shifted. They went from the original kind of militants to then, hiding deep in the woods and, all kinds of nefarious business dealings that were, keeping them going. But ultimately, the peace agreement was to bring this entire subpopulation of the country back up into the light of day and into legitimate government. And they're negotiating, and I'm like, oh my God, you guys, this is going to be a huge disaster. All these folks are going to come back to the city. You're just going to get this huge population displacement. It's going to result in massive homelessness. And they kept like kind of ignoring me, blowing me off. Don't worry, Linda. Don't worry. It's fine. It's fine. And then it was fine. And I'm like, how did that happen? And ultimately, it was understood that there would be a huge need for relocation assistance, a huge need for housing, and a huge need for supports for social integration back into mainstream society. And the national government put all of those systems in place. And so that is a lesson. So if you want to, a lot of times people read this book and they're like, oh, a bunch of Pollyanna. They think that homelessness is solvable. But we know homelessness is solvable. We've seen it happen. We have seen how really concerted efforts. Yes, you have to have resources, but you have to understand the dynamics. You have to apply the interventions based on knowledge of what works, evidence of programs that have to be structured in a very specific way, applied in a specific way, and the individuals supported and engaged in a specific way. So, but with the resources, the evidence of what works, and the coordination and commitment and collaboration, we know that you can solve homelessness. The example in Colombia is one. The example with veterans in the United States is another, where they are already eligible for really robust, high quality medical and mental health services. They're already eligible for rental assistance support that can get them access to an affordable unit. And but there was nonetheless, if you looked, 10 years ago, if you looked on the streets and you asked people, overwhelming disproportionate representation of people who have history of military service. And so veterans are just, all over the place in shelters and on the street. And it was a lack of coordination. And when they set their mind to it, they solved veterans' homelessness in many cities. And in fact, it's so significantly that many considered that it has been solved at a national level during the Obama administration. So we have examples that show that it can work. And so to me, it's about using the evidence and committing the resources and more so leveraging the existing resources to make them work and then solving homelessness.
And Linda, thanks for taking us in a positive direction again, because I felt like I took us off into it's such a complicated issue and so many things are happening. But and I just want to double down on what Linda said, is that it is an issue that can be addressed effectively, but you also have to keep in mind that things are dynamic and you can't stop. The work never stops. There's and because there's always going to be inflow and there's always going to be challenges, and as long as you plan for that and you adjust, you have to adjust. You're going to have some failures. You're going to have some ups and downs. And one of our city leaders uses a wonderful term that she I think she coined, relentless incrementalism, and it's that you can make a difference, but you have to accept that you're going to have these bumps along the way, and you have to adjust to those changes and tweak it, learn from your failures, double down on your successes, and and really monitor the outcomes, and be very frank and accountable and public about what's working and what's not working. But you can have an effective strategy.
On a brighter note, you mentioned homelessness is a challenge. When you look too far down the road, you're unable to see that small changes, like you said, can add up to bigger changes over time. And you might lose sight of the bigger picture if you look towards what the end goal is. So I appreciate that kind of insight. So taking it back, to the book, you mentioned there's a lot of innovations that you present from those different cities, the 10 different cities the book is focused on. So I wanted you to kind of you present them in terms of kind of levels of prevention. So, if we're talking about primary prevention for homelessness, what are some examples of those?
I feel funny talking about it because Linda actually implemented the program in New York City, and it was a home-based community prevention program, and so that was a great example of primary prevention, where you're actually using data to model who are the most likely people to become homeless, and it's really difficult to predict, and what Linda did in New York City is she said, I don't just want it to work here, but I actually want to evaluate it in the most scientific way. And she created a randomized controlled trial where people were assigned to the intervention group or not. And so she created really strong evidence in the field that showed that you can actually predict very well, and actually and even among those individuals, those families who ended up in shelters, you could reduce the length of stay in the shelter program. So Linda, I don't know if you want to add to that, but that's a great example of primary prevention.
Yeah, and it was great because the evaluation also demonstrated that the cost of the program far exceeded the savings. It's really hard because sadly we live in a world with great degrees of concentrated poverty and income inequality. And it's very hard to distinguish one poor household from another in terms of figuring out who's most likely to become homeless. And so we used a huge amount of community level data. And so it demonstrated that we could, with sufficient adequacy, identify those most at risk, such that it dropped the onset of homelessness by about 20%. But then the conducting the survey gave us insight into something that we had never anticipated, which is that for people who received the service but became homeless nonetheless, it reduced their shelter stay significantly. And so that prevention had actually given them resources, connections, and social support. So despite the fact that they had an episode of homelessness, they were able to solve that more quickly. And there were even more savings greater than the pure prevention in terms of the reduction in the time spent in shelter. So if you look at it just from a budget point of view, because of course it's hard to make the case that we know enough that we can adequately predict who's going to become homeless. So the budget officials were always very skeptical. And so you have to make the case based on the ability to run an efficient and effective service and from a cost perspective. But ultimately, if you think about the trauma that was avoided in those, mostly young children's lives who are disrupted from family and friends and school, and the untold savings just in human trauma as a result of that, it's very encouraging. Now, it's so interesting, sort of as public health folks, and interest in advancing this work. We took a lot of heat for doing a random control trial on homeless prevention. People called us inhumane, uncaring, thoughtless, bureaucratic, soulless people, that we would ever put anyone on a random control trial, because basically we're saying two equally poor, at-risk individuals, the half is going to get the service and the other half, you're not going to get the service. And a lot of people found that morally objective. And from my perspective, we took the blows associated with that, because nobody is getting the service beforehand because we can't prove that it worked. And so this is another really tough thing when you talk about evidence-based services. You just got to go through the hard work of demonstrating it works. And sometimes that means taking the criticism associated with these kind of experiments.
And let me add to that, Linda, because I think you deserve credit too, is because you were able to show that it was effective and that the city was willing to pay to expand it. And so it was expanded and actually impacted citywide. Many more people. Exactly.
Yeah.
Awesome. That's an awesome example. I remember that's one of the things I struggled with in my epidemiology class. I would ask my professor, why are we randomized doing some RCTs for things that we know works, and he says, but do we know that it works? So the whole point is, if it's ethical and we're not, causally certain that something works, in that case, it's ethically allowed to do a randomized control trial. And as you mentioned, when it was determined that it, was known, proven to work, then it can be expanded to the people who are maybe not in the actual intervention arm of the RCT. So that's a cool example.
Yes, yes, exactly.
So in the book, you also mentioned that a key element to successfully tackle homelessness, and you mentioned it today as well, is systems level thinking and being able to focus on that coordinated strategic response. So what does a systems thinking coordinated strategic response look like? And I think it'd be very interesting to hear from your personal experience in office as the deputy mayor. What kind of actual practical challenges were there that kind of limited that response?
Yeah, it's ego and bureaucracy and laziness. I don't know. Sorry, I'll think of some more insults to throw at people. I don't know. Sorry.
Love it.
But it's I'm thinking what came to mind based on my own personal experience was our effort to better leverage and expand supportive housing in New York City. And so here's how it used to work. The Human Resources Administration it turns on services for individuals, and so they determine eligibility. And so they've got their little assembly line eligibility process where people have to fill out all their paperwork and demonstrate a level of need, and then they turn on the service. That was the client that we're trying to get the service is at the Department of Homeless Services, either on the street or in shelter. And the Department of Homeless Services is trying to prioritize the individuals who need supportive housing based on those individuals, the acuity of their need, and trying to avoid having somebody who's going to solve their own homelessness without supportive housing. We don't want them filling this incredible rich resource of a supportive housing bed. So Homeless Services is trying to, push the right people to the front of the line. But the line is controlled by Human Resources that is, telling people when, whoever, first come, first serve, whoever applies, then we just move them along. And whenever you're eligible, bingo, now you can move into supportive housing. And then supportive housing itself is managed by the Department of Housing Preservation and Development, because they do all the hard work of putting the resources together, buying building the units, and then contracting with nonprofit providers who are operating the housing itself. And so the front door, like when an apartment opens up, is controlled under a third agency, and then there's actually a fourth role, which is the Department of Health and Mental Hygiene, which provides the service contracts that are supplemental to the housing contracts that provide the on-site services for supportive housing. So all these agencies, all working separately, and the bottom line is that it almost worked to the effect that the easiest to serve people who least needed the housing were getting into the units, because they could navigate all those bureaucracies. The nonprofit providers are like, do I want this pain in the butt guy who's going to do nothing but, kick down my doors and assault my workers and, be trouble, into perpetuity? Or do I want this, nice, docile young person who looks super cool, and he's going to come in and he's going to get a job pretty quickly, and he's just going to be a nice, upstanding citizen. So we wanted to improve the placement. And so the way that we got to do this, so I was the homeless commissioner at that point. I collaborated with the housing commissioner, the mental health commissioner, and the human resources commissioner. I took them all out to dinner. I sat down, I bought maybe more than one bottle of wine, and we talked about why we were doing our work. Why do we get up in the morning and go to our jobs? And what are we trying to do? And by the time, the end of the conversation, okay, it was more than one dinner, and it was a lot more people. But ultimately, we joined together in the shared vision and the shared value around the highest and best use of a precious resource, and getting our systems to stop acting as individual kind of siloed bureaucracies, and getting them to work as a single system, which is, from a client's point of view, I don't know anything about this. I just know this is one process to get me into a bed, right? And so that wound up generating a huge number of reforms. We actually consolidated contracts. Instead of everybody doing their own contracts, we put them under one umbrella and moved the money to one agency that would do the contracts. We streamlined the eligibility and placement rate, agreeing on who the most suitable person, to receive placement. And then what that required was an agreement on that everybody jointly talk about the kind of the waiting list and the extent of the demand, and agreeing on who should take highest priority for placement. And then the providers came to the table as well, the nonprofits. They acknowledged that, they said, hey, listen, we have to manage an orderly place, right? It can't be mayhem. The housing has to be stable, but they acknowledged that they were doing some cherry picking, and they too agreed to this highest priority thing. So none of that would happen unless you really tackle like all those like little mini fiefdoms and control. You got to give up some power. You got to agree to let somebody take your turf. And that's the hard work of collaboration that makes systems work better.
Dinner and wine.
It does it.
Yeah. Thanks for all the interesting insights. I hate to see that we're running out of time there, so I just want to transition to final words. And Tamiru, you didn't get a chance to give your insights on this one, so I'll throw this question to you first, and we'll send it to Linda to wrap it up. But what should our audience take away as those key attributes that are required to drive this meaningful change that you've been describing throughout this podcast as it relates to homelessness?
Yes, I'd say, so as Linda said, the systems-based approach, really just creating a collaborative structure used to address the multiple sectors, and that can be healthcare and housing and workforce, and clear targets need to be set and monitored, and outcomes reported to the public, really, really important. And I'll just say, like in the book, we do, in addition to New York City, we talk about two big success stories, Edmonton and Houston. They really stand out as models for this type of systems-based approach. And since 2010, Edmonton reduced homelessness by about 43%, and Houston in around the same period did so by about 50%. And a key part of their approaches is getting people into housing. So I would say that that's another key attribute, is a housing-led approach means get people into housing. Don't wait until they're before get them into housing before you address any other need. And that's what it really means in simple terms. And I would say that the amazing thing about these two cities, and this is important for other cities because everyone says we don't have enough funding. These two cities did not have a lot of municipal funding to do this work, but they did have the important resource of leadership and commitment from the top, whether it was a non-government organization or whether it was the mayor of the city, and because they had that leadership and that collaborative structure, and they were able to harness the resources of many stakeholders, they were able to have an impact. And so these are examples of models. It can work. You can make a difference. There is hope.
How can you top that? Bravo, Tamiru. That's it. And that's what I hope people will get from this book. It's really hard work, and it can be very frustrating, and you can have lots of failures, but you can't give up, because we know we can make progress. And it's not just numbers. These are people, their lives. There's nothing that can be more fulfilling than being thanked by somebody who was in a really, really terrible place in their lives and had the kindness of the providers and all the frontline workers that are just working day in and day out in order to try to get them to a better place, and then to see their dignity restored to their lives is an incredibly moving and compelling thing. And if that's, as a society, not what we're about, then I don't know what we are about, right? And so it's really I hope this book is a as a thank you to all of those folks. And then, for others that are in the middle of it and need to feel like some partnership with their colleagues elsewhere, we hope they can see themselves in it.
Fantastic. And thank you for sharing your insight. And just for the listeners out there, we're having a discussion based on many things that are touched on in the book, but it only scratched the surface. So we definitely recommend everyone to go out and check out the book. Again, it's titled How 10 Global Cities Take on Homelessness. And where can our listeners find the book?
At your local bookstore. I'm sure that you can they can order it for you. You can get it from the University of California Press, which is the publisher, and of course if on Amazon as well.
And my understanding is that all the proceeds from the sales go towards a cause.
Any of the authors are whatever gratuity that we would have gotten is being dedicated to Bowery Residence Committee. One of our co-authors, Muzzy Rosenblatt, is the executive director. And so hopefully, if you buy a book, just know you're also making a donation to BRC as well.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.